Hi everyone. My name is Vanessa Larochelle. Today I will be discussing the importance of data quality in the healthcare and long-term care space, how system differences and clinician and analyst disconnects can result in impacted data quality. And I will discuss my process of completing a sector intelligence analysis and how I created an educational tool for the Canadian Institute for Health Information. So first and foremost, I want to give some thanks and some acknowledgement. I would like to acknowledge that the area in which I worked, reside, study, and continuously appreciate is situated on the traditional territory of the Wendat, the Haudenosaunee, and the Anishinaabe, including the Chippewas and Mississaugas of the Credit First Nations. From the University of Victoria, I'd like to thank Mira, Margaret, and Heather working through this past semester. From CAI, I'd like to thank the lovely specialized care clinical team, my supervisors, Christine and Jacqueline, Natalie, Maria, Pamela, and Patricia. And then finally to my friends and family, thank you for your support over the last few years. So starting off with CAI, so the Canadian Institute for Health Information is a nonprofit organization that provides information on health systems in Canada and the health of Canadians. So the majority of data at CAI is created as a byproduct of delivering healthcare, so often at the hands of health professionals. So processing and analysis of this data is completed by analysts and data scientists, in which they conduct statistical analyses and essentially paint a picture of health performance in Canada. So CAI's guiding vision, which is better data, better decisions, healthier Canadians, reflects the importance of accurate data to shape healthcare decisions, both at point of care and system-wide. So I started with a literature review, looking at the health system in Canada and particularly focusing on long-term care. There are vast system differences, business processes, terminologies, and legislature that differs by province and territory, as healthcare is a jurisdictional responsibility. These differences from province to province make it difficult for data scientists who analyze this data, work across different jurisdictions, or summarize healthcare across Canada. So the structure of long-term care in Canada is no different to healthcare structure, in which it is a provincial or territorial responsibility, with some jurisdictions having multiple health authorities governing their own practices within one province. So provincial funding models is one major difference, especially in long-term care, where an individual may pay for all costs associated with long-term care services in one province, and another individual having all costs completely covered by their jurisdiction. So here, this really exemplifies that system-wide differences vary from coast to coast. And then the second literature point that I looked at was, it's a really well-documented challenge in healthcare and long-term care, and it's the disconnect between clinicians who generate the data and the data scientists who use, clean, and analyze this data. There lies an issue from the analyst perspective, as it may be difficult to understand clinical processes and terminologies when working with the data. And then on the other hand, clinicians may have a difficult time understanding the clinical relevance and interpretation of certain data, especially if using the analyst-generated data to make healthcare-informed decisions. These two issues may lead to inefficiencies in the data itself. So when vast system differences and clinician-analyst disconnects occur in the health system, and particularly in long-term care, quality and accuracy of data can be compromised. Decisions around health systems and patient care may be based off of inaccurate data or misinterpreted data. And without accurate and reliable data that is understood from both parties, patient safety and outcomes may be at risk. Health system policies and decisions may be based off of inaccurate data. So how can we help address this? And what did I do? So to begin, we can help educate the data scientist side and provide them with tools to better grasp system-wide differences across Canada, provide information on health system and long-term care governance structures, processes from the clinician perspective, information on the terminologies and language used, and information on the policies that guide these processes. So a sector intelligence report is a document or an educational tool that provides an in-depth analysis of trends, challenges, opportunities, and key stakeholders across different sectors, in this case, the long-term care sector in Canada. An analysis and scan of various long-term care components was completed for each province and territory, and an educational tool in the form of an Excel spreadsheet was created for CIHI. So what is the benefit of sector intelligence analyses? They're actually quite beneficial to policymakers, healthcare administrators, and other stakeholders to make data-driven decisions while serving as a central access point for information. This tool was created for data scientists at CIHI and analysts to reference when working with various stakeholders across different jurisdictions in Canada. While the tool itself was quite large and would take up a whole bunch of time to show, I wanted to kind of briefly touch on what it looked at. It took a look at the different governance structures, province to province, types of facilities in the long-term care, including short stay programs, funding models, business processes, legislative requirements to report, and various other components. Because we don't have the time, I selected a few provinces and territories that had different processes from one another in hopes to demonstrate just how different health and long-term care is across jurisdictions. So first and foremost, I wanted to take a look at British Columbia as we go to you, Vic. So long-term care, or alternatively referred to as residential care facilities, is governed through 5 regional health authorities, with each having their own clinical assessment processes, assessment tools, and process of flow of information. 4 out of the 5 health authorities use an older assessment tool called the RI-MDS 2.0, while Interior Health uses a new long-term care tool titled the Inter-RI LTCF. There are 309 facilities throughout the province in which 40% of all homes are publicly funded by the government. And then in 2023 to 2024, 95% of all homes reported their data, including patient outcomes and quality indicators, to CIHI, as the provincial government has mandated the reporting of such information to CIHI. And now looking at my home of Ontario, long-term care is governed by 6 interim health regions and is funded by the Ministry of Long-Term Care. Ontario is one of 2 provinces in Canada to offer complex continuing care units in which long-term care services are offered in a designated hospital unit. Long-term care is referred to as such, and it consists of 621 homes and 97 complex care units. Roughly 75% of all homes in Ontario are privately funded, and assessments are used to support funding for homes. Ontario is in the point of transitioning from using the old RI-MDS 2.0 tool to the new Inter-RI long-term care tool. Therefore, both assessment tools are being used across the province. And then in 2023, 97% of homes and complex units reported to CIHI. And then similar to BC, there is legislator outlining the need to submit long-term care data to CIHI for pan-Canadian comparisons. And finally, taking a look at Nunavut, long-term care is governed by one single territorial health authority, and it consists of 5 fully publicly funded continuing care centers, or alternatively known as nursing homes. Long-term care is particularly difficult to access due to isolation and a limited number of staff available. Many residents that require long-term care services are sent to out-of-province homes to receive care. Nunavut is completely different to other jurisdictions, as they do not use any assessment tools to assess level of need for services that are common to other jurisdictions as the Inter-RI tools. Nunavut does not report their long-term care data to CIHI and are not mandated to do so through their legislature. So, from building the tool, the tool was created using a SSS framework, which addresses scalability, serviceability, and sustainability. So when using a SSS framework in education, the tool is noted to be more effective and longer lasting. So first, addressing scalability, the tool format and its location in a shared library allows to be reaching the maximum number of CIHI employees as an easily shareable Excel spreadsheet, therefore allowing a broader audience if needed. To address longevity and lifespan, an Excel spreadsheet is a relatively simple tool to use and update and does not require addition changes or alterations beyond the control of CIHI staff. And finally, looking at sustainability, the Excel tool can be readily revised to include new information as it arises compared to if it were a physical resource. A sustainability plan has been created for the continuation of this tool after my placement has concluded. And a team approach is to be taken for the upkeep of this tool. And while current ownership lies with the clinical team that I work with, one clinical specialist and one data analyst are to divide and update the topics in columns according to specialty every 6 months, followed by a presentation with senior management. And finally, collaboration with client affairs managers who work directly in and with these stakeholders in these jurisdictions is highly recommended to have the most current up-to-date information in the tool. So that is my presentation. That was the sector intelligence analysis with CaiHi, and I'm happy to hear some questions if anyone has any.